says copy, it's the cutoff, right? Which is
Oh
copy.
yeah. Okay.
But I can never remember which is which, so I
I
labeled
always
it.
thought that putting it in the center determined what's online, like if that's right or not.
You have to press on the
No,
right.
that's right.
Good evening, ladies and gentlemen. We have quorum in the room, so we'll get the meeting going. First item for this evening, I've got a ceremonial function that I have to perform. So before we get onto the agenda, we'll handle that duty first. Thank you. Well, good evening, everyone. Bonsoir, mesdames et messieurs. As you will see, this evening's agenda includes a ceremonial item to recognize Ottawa Public Board of Health staff for their exemplary accreditation that we received from the Accreditation Department or Board. You probably remember that last June, an Accreditation Canada team of surveyors visited OPH to conduct an evaluation of its process and practices related to quality and client safety. More recently, OPH has been accredited with exemplary standing. This is the highest possible level of accreditation given exclusively to organizations that go beyond the accreditation requirements and demonstrate excellence in quality improvements. I think this achievement is a very important milestone on our quality improvement journey and a testament to our efforts in building and strengthening a culture of quality, safety, and excellence. It's my pleasure to ask Esther Mogadam to come and join me up here. As a result, I would like to congratulate OPH staff by presenting a certificate of recognition. Having Esther beside me, it's a great pleasure for me to present this certificate to Esther and the rest of the team. And for those of you that don't know the accreditation process, it's quite a lengthy process. I did take part in it for about a day worth of proceedings. And some of the questions that were put to the board or put to the representative that were representing the Ottawa Public Health really surprised me, even in terms of what kind of stuff that the accreditation staff looks at and what they're really looking for. To get the exemplary statement, as I said in my comments, is I think beyond everybody's expectation. But more importantly, I think it's a testament to this team of the Ottawa Public Health under the leadership of Dr. Levy. So congratulations, Esther. And the certificate we'll present to you in a minute. Congratulations.
Thank you so much, Chair. Oh boy, thank you so much, Chair and members of the board for this team recognition. I think I speak for all employees and for our community partners who are really so proud and so thrilled that Ottawa Public Health has received exemplary status of excellence. About 4 years ago, we had a conversation about not just what quality means to us, but how we can deepen the effect of quality on our services for residents of this community. And an incredible team emerged. And this team took the quality conversation deep into the organization, and working with colleagues and clients and partners together enhanced opportunities for even more innovative, safe, effective, and collaborative services as we finalized our preparation for the Accreditation Canada visit and assessment. And we're not going to stop, because we really believe that quality is a continuous process of improvement. So as a next step, of course, we're reviewing the survey results and other findings with staff and with clients to continue pursuit of our quality journey. So this incredible team comes from all corners of the organization, and many of them are here this evening to celebrate the achievement. Others are online following us on webcast, and I would just like to invite those who have been able to make it here to come forward for a group photo. So there are a number of people who make this incredible team up. Mary Claude Thibault, as I call your name, if you could come forward. Board, Christine Bouchard, Irene Dolan, Kelly McKay, Zaida Udin, Nancy Kennedy, Lynn LaFrance, Harpreet Graywall, Donna Perrin, Suzanne Brolin, Jane Dare, Jamie Jones, Don Bremner, Roseanne Edwards, Catherine Watson, Eva Stewart-Bindernagel, Barb Campbell, Cheryl Smith, Lise Lebrecq, and members of the Ottawa Public Health Quality and Safety Council. Merci à tous.
Thank you very much, Esther, and thank you to the team that's standing here this evening, plus the people that are watching us on social media. I think from an position of the chair, and along with my colleagues on the board, I want to wish you, first of all, congratulations, and a thank you for being recognized on this particular certificate. It's something that I think the board appreciates, obviously, but I think this is a reflection of your work. So thank you very much, and thank you, Esther, for doing all this.
Thank you, Chair. Thank you so much. That's very nice.
Well, thank you, everybody, and great job and great work for all the staff members that participated in the accreditation certificate, but not only them, but all the teams in the background that help on a daily basis. Now, that's one piece of good news. The other piece of good news that I'm going to share with you, though, although the gentleman didn't want me to share this, Dr. Levy received his 10th year pin of serving as medical officer health this evening. Well, congratulations again, Doctor, and we're looking forward to another 10 years at least of service from you. So, thank you. He didn't want to commit to anything, right? Anyways, sorry. Roll call, Madam Clerk.
Member Chernyshenko?
Présent.
Membre Fleury?
Ici.
Member Kapoor? Member Lakin?
Present.
Member McKenney?
Present.
Membre Pinel?
Présent.
Vice-présidente Poirier?
Présente.
Chair Kadri?
Present.
Member Kakish?
Here.
Member Taylor? Member Tilley?
Present.
You have quorum, Chair.
Thank you very much. Confirmation of, first of all, declaration of pecuniary interest, including those originally arising from prior meetings. Seeing none. Confirmation of minutes. Confirmation of minutes of the meeting of June 20th. Carried? Carried, thank you. Communications, we received 15 communication items have been received, and they are held on the board assistant. The motion to introduce reports. Member Tilley, please.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, Reducing Preventable Infectious Diseases Strategic Direction Report, Ottawa Public Health Submission to Federal Task Force toward the Legalization, Regulation, and Restriction of Access to Marijuana, 2016 Operating Budget Q2, Board of Health for the City of Ottawa Health Unit Status Report, Delegation of Authority, Contracts Awarded for the period of January 1st to June 30th, 2016 report, and Ottawa Board of Health Public Health Funding and Accountability Agreement 2016 mid-year update be received and considered.
Is that carried? Thank you. Moving on to the agenda, Chair of the Board of Health verbal report. Item 1 we'll hold for presentation. Same thing with item 2 with Medical Officer of Health verbal report. Item number 3, Reducing Preventable Infectious Disease Strategic Direction. The recommendation is that the Board of Health approve Ottawa Public Health's 4-pronged approach to enhancing the community's collective capacity to reduce preventable infectious disease as outlined in this report. We do have a presentation for that item, so we'll hold that. Item number 4, Ottawa Public Health submission to Federal Task Force on legalizing marijuana. The recommendation is that the Board of Health for the City of Ottawa Health Unit receive this report for information. There is a presentation on this item also, so we'll hold this item. Item number 5, the operating budget quarter 2, Board of Health for the City of Ottawa Health Unit status report. Recommendation that the Board of Health for the City of Ottawa Health Unit receive this report for information. If any board members have any questions or comments, otherwise can we receive this report? Thank you. Item number 6, delegation of authority, contracts awarded for the period of January 1 to June 30th, 2016. Recommendation that the Board of Health for the City of Ottawa Health Unit receive this report for information. Anybody have any questions or comments? Or if none, then can we receive this report? Thank you. Item number 7, Ottawa Board of Health Public Health Funding and Accountability Agreement 2016 mid-year update. That the Board of Health for the City of Ottawa Health Unit receive the following for information. Summary of amending agreement number 5 to the Public Health Funding and Accountability Agreement between the Board of Health and the Ministry of Health and Long-Term Care as outlined in this report. Recommendation 2, completed 2015-2016 school year results for the oral health assessment and surveillance indicators as outlined in this report. And number 3, 2016 year-to-date results as outlined in this report. Can we receive this, or if we have questions?
I just have a question. The report seems to highlight the period-to-period, year-to-year issue that continues with the province in terms of fiscal, allocations. So I wonder if in the verbal update from our medical officer of health, if you can briefly talk about the progress on that front.
Does anybody else have any other questions so we can hold it, or do we want to just deal with Councillor Fleury's question? Okay.
Yeah.
Go ahead.
Thank you very much. So I think actually we'll end up dealing with it substantively at the next meeting when we table our draft budget for 2017. I think you're right. Some of the challenges do indeed persist. The province has continued with its second year now of the new funding formula. Ottawa Public Health does benefit from the new funding formula because it in part redresses previous historical underfunding relative to other health units. We had hoped that that funding formula would be more aggressively pursued in terms of timeline. So last year we did end up having, for the provincial cost share portion of the budget, we ended up having close to a 6% increase, which was sorely needed. This year, for that particular line or series of line items, we're at just a little over 2%. But the context is that some 2/3 of local health units received 0% increase, and so from our point of view, we continue to do reasonably well in addressing previous problems that have resulted from the funding formula. From a management point of view, we manage to the bottom line, and so we do end up fairly aggressively aiming to balance budgets by the end of the year. And that is there are challenges from a programmatic perspective doing that, but we do carry on doing that. And from the municipal point of view, it means that we don't have to go above the allocation that was previously allocated to us from a municipality perspective, which would require this board to go back to the council in year. So we were satisfied with the funding. We'd hoped for more, but we're able to work within it for this year, and its implications for next year are somewhat challenging, but we'll be bringing forward that discussion at the next meeting. Does that address what you were getting at? Thank you. Yeah, I wasn't going to mention that in my verbal update, so thank you for the opportunity.
Thank you very much, Doctor. And if that's the only question, can we receive this report? Thank you. Okay, moving back to item number 1, my verbal report. You know, it's been a busy summer. It's been a good summer in terms of weather, but it's good to get back to this board in terms of having our first meeting since the summer. It gives me great pleasure to welcome Dr. Munir Taha, the Associate Medical Officer of Health. And I'm pleased to begin this evening's meeting. Thank you, Dr. Taha, for coming. And welcome to our group. And just give you a little bit of bio to the rest of the folks in the room. And look forward to your work with the Ottawa Public Health. Board members will recall that Dr. Taha was selected following a rigorous national recruitment campaign and joined Ottawa Public Health this past July. With over 20 years of experience working in the public health field in Ontario and New Brunswick, Dr. Taha brings a wealth of expertise to OPH on a variety of public health issues of importance to Ottawa residents. Most recently, he served as an Associate Medical Officer of Health and Director of Chronic Disease Prevention and Oral Health with the Halton Region Health Department. Once again, welcome Dr. Taha to our organization and to the city. Thank you. Breastfeeding Week. Next I would like to highlight Breastfeeding Week, which was observed over the first week of October. In celebration, Ottawa Public Health held several virtual events on Facebook with the aim to promote the importance of breastfeeding for infants' nutrition and health. Parents and soon-to-be parents were invited to engage with Ottawa Public Health nurses and each other on Facebook to talk about a number of important issues around breastfeeding, including creating supportive environments, promoting the normalization of breastfeeding, and providing support for breastfeeding women. The online event also aimed to increase awareness of breastfeeding support services, such as the Ottawa Public Health Information Line and Parenting in Ottawa drop-ins, where parents can go to speak with public health nurse for breastfeeding support. Check out the Parenting in Ottawa website for dates, times, and locations of Parenting in Ottawa drop-ins. Vaccine displays. Next, if you happen to be at the Mary Pitt Center at 100 Constellation Drive, where Ottawa Public Health's head offices are located, I would encourage you to visit a new exhibit which explores the fascinating history of vaccinations. The exhibit is the culmination of hard work and collaboration with a number of community partners. There will be an official unveiling ceremony with partners in the near future. Board members will be advised of the details as soon as they become available, and information will also be shared through Ottawa Public Health's Twitter account at Ottawa Health. Accreditation that we just acknowledged. Finally, this past June, Ottawa Public Health achieved an important milestone on its quality improvement journey in receiving accreditation from the Accreditation Canada. Ottawa Public Health was accredited with exemplary standing, which is the highest possible level of accreditation. It is given exclusively to organizations that go beyond the requirements of Accreditation Canada and demonstrates excellence in quality improvement. Moreover, this remarkable achievement is in recognition of the dedication and hard work of the over 600 Ottawa Public Health employees. I would like to commend these employees who strive to provide the highest level of service possible to our community each and every day. This concludes my comments. Any questions, any comments? No? Can we receive this report? Thank you very much. And item number 2, the Medical Officer Health Report.
Many thanks, Chair. Good evening and bonsoir, everyone. You will appreciate the schedule of our agendas seem a little off. I know we're going to be meeting again in just a few weeks' time because of the budget cycle. And it does feel like it's been an unusual length of time since we last met, just because of the fall, late summer and fall season. Given that unusual length of time and the busyness of the last few months on a number of fronts at Ottawa Public Health, I must warn you, my update will be a little longer than usual. Chair, I want to thank you very much for your kind words. I feel, as I say, a little heavily bejeweled tonight. It is a nice feeling to reflect on the 10 years that have been here. It's been a very rewarding and fulfilling time. The staff are tremendous, the partners are tremendous, and it's a pleasure working with all of you as well. But I do warn you, by the time I'm finished, you'll feel like we've been going for 10 more years. I'll try and be fairly quick, but tonight I want to touch on some provincial issues, mention some promising federal developments, talk a little bit about some key programmatic developments and changes that have happened, and just mention briefly some elements of the recent changes at the municipal level, because all of these different things that I'm going to talk about do have implications for our work, so it's important that you're aware of them. Before I do that, though, I also want to formally note my own pride and congratulations to you, actually, to our governors, to the team, those of you who are with us tonight, or even online out there in the cyber world. The pride I feel with working with our entire team, our senior leadership team, and all of our employees, and indeed our partners in the community, relating to the Accreditation Canada decision about where we stand as an organization. Those of you who are familiar with Accreditation Canada will know that it is the preeminent accrediting body for health organizations in Canada. Its processes are very rigorous, it's very well respected, and to have achieved exemplary status in our first full accreditation cycle with Accreditation Canada is really, it's a validation of the results of the efforts that we have collectively as a team have put our minds to. There really is, of course, always ongoing work to do as we continue to pursue excellence in our work. But this is a rigorous peer review process, and it's very gratifying to give us to know that we're in a good place, and also to hear the comments that are made in that process, because it gives us a sense of comfort as we build our quality improvement plan into the future, that it's based on peer review and there's a legitimacy and a validity to it. So thank you for your kind words, Chair Kadri, and I want to echo those words to everyone involved, which certainly includes you. With respect to the province, so I think it's become trite now. I say in every one of my verbal updates that the provincial government has been fiddling around. We have a very active Ministry of Health. They're active on a number of fronts at the moment. Firstly, I want to remind you, I've only mentioned this casually in passing in the past, but it's maturing to a point that it really is necessary that you're consciously aware of the current review of the Ontario Public Health Standards. You're aware, of course, of the importance that the standards play in setting the tone and direction for our work. The province has advised that they intend to consult on a draft set of revised standards within the next few months. And this will provide an opportunity then for input from the local public health levels, from particularly practitioners, but indeed also from governors. Past experience suggests that when the consultations happen, they happen on a very short turnaround time. And so sometime in the next several months, we'll probably get a few weeks to respond to a fairly substantive document, and one which will have profound implications for the next 5 to 10 years of our work. So we're gearing up at the staff level. We're going to be planning to analyze and assess what comes forward and provide a response to those consultations. And we'll be keeping you abreast of those developments and opportunities for your possible input as well. I also mentioned at the last meeting that the Ministry of Children and Youth Services is undertaking a third-party review of the Healthy Babies, Healthy Children program. So that's distinct from the review of the Ontario Public Health Standards. The process is underway. We've been solicited for our perspectives on needs and challenges in that program, and we're anticipating that we may learn of the findings by the end of the year. And I assume that the findings will inform the Ministry of Children and Youth Services as it develops its future plans and expectations, funding plans and expectations for that program. So we'll keep a close eye on that. The important thing to be aware of is that any changes to the standards will also lead to changes in boards of health's performance indicators. So we've just, of course, got our heads around the current performance indicators, and the progress in meeting them are detailed in the document that you've just adopted. That was, I think, item 7 on the agenda. One comment I didn't make in response to the question that is, I think, important is we've seen over the years that the numbers of indicators continue to increase, that the target expectations that the ministry has of the board have steadily risen. And I think that we can expect that the next iterations of the accountability agreements will be no different. So really, in summary, what I'm really saying is that as we look ahead to 2017 and beyond, the funding is an important piece, and some of the local context around 2017 activities will be very relevant to that. But independently of that, I don't think Ontario local public health units are going to be engaging in business as usual. We're going to see a lot of change in the next year or so, and we'll be needing to review our organizational approach and operations as we adjust to what I think may be significantly different and higher program standards and accountability measures. We'll also need to adjust to other new legislative requirements, and there's quite a range of what's going on the legislative front at the province. We expect changes to the food safety regulations. They've been under review for some time. There are new requirements, as you know, around around menu labeling in certain restaurants. And the big one is major changes in the healthcare system delivery by local health integrated networks and community care access centres. So in that context, just last week, actually, the province reintroduced the bill that was known as the Patients First Bill, had been introduced before Parliament prorogued in the summer. That Patients First Act of 2016, an amended version, was reintroduced as Bill 41 last week, or just the end of the week before that. And we still see that several sections of that new legislation make specific reference to health units. So we will be required to engage with the local LIN on issues relating to health system planning, funding, and service delivery. That's clear. What isn't yet clear is any specific operational or cost implications of those requirements. So we'll obviously be monitoring those developments and assessing potential impacts and opportunities as well. The work we do, of course, is impacted. We don't talk about it that often, but it's not only the provincial level activities of government that impact us, it's also the federal level. And the actions and intentions of the federal government interest us and impact us. Later this evening, of course, we'll be talking about what we've been doing to prepare for changes in the approach that our government and society is taking to marijuana. But there have been a few other things at the federal level that I think are, from my point of view, quite promising. In September, the federal government announced its intention to extend the federal tobacco control strategy to address vaping products in Canada. We expected that might happen. We'll have to watch and see how it rolls out, but I think it's really helpful that they're moving in that direction. And another thing that really does, I think, represent some exciting development is there have been 2 private members' bills recently introduced. And I realize they're private members' bills, but one's in the Senate, one's in the House of Commons, so there's fairly broad interest in this. And these address the issue of marketing of foods and beverages to children. So we've discussed before, and this board, in fact, has previously supported the intention of the federal government to restrict marketing of unhealthy foods and beverages to children. So seeing movement on this front, I think, is wonderful. And we'll be monitoring that very closely, and I've asked the team to really explore ways that we can help ensure progress on that issue and see that policy can evolve and see what we can do to make sure that that issue stays on the front burner. Developments from a programming perspective, you'll remember I mentioned in the summer that grade 7 boys are now eligible for publicly funded human papillomavirus or HPV vaccine in Ontario. So we've started vaccinating boys as part of the school immunization program. Obviously, significant logistical challenges implicit in that casual statement because we're expanding operations to a new cohort on a fairly short timeline, but we've already, since the start of the school year, the team's been able to accommodate these changes. We've already got about 900 boys vaccinated since the school year started. And, of course, during the course of the year, we'll be offering the HPV vaccine to all boys and girls in grade 7 and still to girls in grade 8 because that's their second dose. So we've got about 15,000 eligible students for HPV vaccine. It's an excellent vaccine. There's still probably roughly 2/3 of people who are eligible avail themselves of the protection that is offered. And if anyone out there happens to be watching this and might be eligible or have a child who's eligible, I really would urge those students to avail themselves of this opportunity. We're also continuing to fully enforce the Immunization of School Pupils Act. Last year we shared with you our Every Child, Every Year approach, which was a new approach, much more intensive than we'd been doing vaccine surveillance historically at least in the last 8 to 10 years. So that means warning notices regarding school suspensions will begin to be mailed for schools later this week, actually, and we expect some school suspensions will be taking effect between January and April of 2017. I think we're over the hump, though, in terms of this, the community's understanding of what we're doing and achieving, and I think we'll probably get less noise and more an easier programmatic time as we move into the second year of this fairly intensive and aggressive approach to the surveillance. Still on the vaccine front, of course, several of you know that that the province has now allowed us to implement its plans to provide shingles vaccine to Ontarians aged 65 to 70. The vaccine is available now. Over the last few weeks, we've been able to release it, so that's another thing that we would certainly encourage people who are eligible to be aware of and avail themselves of. And lastly, on the vaccine front, it is, of course, flu season. We're just right at the front end of that. During last year's flu season, we administered about 10,000 doses of influenza vaccine at our own community clinics. Over the last few years, of course, we've been offering fewer clinics as pharmacies and primary care physicians have been doing more of the vaccination. So we had about 400,000 doses of vaccine distributed across the city last year, and I'm hopeful that for 2016-2017 we'll be able to achieve that kind of level or beyond that again. We'll be focusing our own efforts on outreach to harder to reach populations, and we'll run our community-based clinics in areas of low pharmacy and physician coverage. It was about 3 years ago that we stopped offering vaccine clinics in every ward of the city. We just really run them now in neighborhoods where there isn't a good pharmacy physician or physician coverage, and it seems to be working. Just two quick updates with respect to other things we discussed at the last meeting. Firstly, the opioid overdose situation that is galvanizing attention across the country. We are aware now, certainly, that powdered fentanyl has become part of the street drug scene in Ottawa as well as elsewhere. And so we continue to work very closely with partners in emergency rooms, police, paramedics, and the coroner's office to monitor what's on the streets and to try and rapidly warn our drug-using community when we have word of new developments. Of course, that's quite downstream. A lot of our other effort is of course, starting in early childhood development programming. We're trying to prevent folks from landing in that situation at all, but we certainly put some effort into ensuring that we've got a quick warning system when we know that something particularly dangerous is creeping into the community. You may also have seen a promising development that last week the province announced that it plans to implement a comprehensive opioid strategy to prevent addiction and overdose. So I expect we'll be called on to participate in that strategy as it evolves locally. The other thing, just to pick up from the last meeting, is City Council did in fact proceed to enact a bylaw to prohibit the use of water pipes in enclosed public places in Ottawa. That was something, of course, you recommended. The way Council proceeded has the bylaw coming into force on December the 1st of this year, and there's a 4-month warning phase, so it'll really be strictly enforced from the beginning of April 2017. We've done some background work. We've informed stakeholders and the general public of these changes, and later this month, working with partners in the City Bylaw and Regulatory Services Group, we'll conduct educational visits to establishments that we know use water pipes to ensure that any questions owners have about the implementation are answered. But what I did want to particularly mention is that since we talked about it at this board, and even since Council passed the regulations, we've received reassuring news about the court application. You'll remember there was, at the time, there was still an open court application against the City of Toronto. Toronto had, of course, prohibited the use of hookah pipes in licensed establishments. There'd been a court challenge. In fact, the presiding judge found that enactment of the bylaw was within municipal powers. That was being challenged, and declined the request to overturn the city's bylaw. So I think that's important because it reinforces that the courts view the enactment of bylaws by municipalities to address public health matters on the recommendations of boards of health as both legitimate and appropriate. And while we may take that for granted, we often hear that that folks question the legitimacy of the kind of recommendations that emanate from tables like this. I will end my comments by just commenting briefly from my perspective on something that has been a concern to our employees and of interest, I know, to many of you, and that's the City of Ottawa's recent organizational realignment and related personnel changes. The announcements that were made at the city about 10 days ago, I guess, had been preceded by about 5 months during which Ottawa's new city manager had engaged in extensive outreach to seek input from stakeholders, which included Ottawa public health employees, to inform decisions that culminated in the city's realignment. I do want to note, just to be really clear, the city's independent boards were not part of that realignment exercise. And so, although we were involved in some of the discussions because your employees are city employees that are lent to the board, immediate operational implications for Ottawa public health, they're by no means trivial, but they are relatively minor. These implications relate predominantly to two things. The first is the need that we have as management to adjust some projects to accommodate employees that are returning from elsewhere in the municipal service. And the second is a need to develop some new relationships with new partners in areas, especially like drinking water services, something Siobhan Kearns and the team in environmental health have very close relationships with drinking water services, but also parks and recreation, social services, emergency services, and all of the shared service support groups. So there is some ramification, but as I say, relatively minor. That said, though, I guess the underlying theme of my comments is that there's change afoot. There's change at the provincial level. There's the recent municipal change, and certainly I hope that I've reassured you that we're staying abreast of it. We're watching it closely. Because I think it creates both opportunities and will create imperatives in the year to come to think about ways to increase organizational effectiveness and to find, unfortunately, efficiencies in order to work within an allocated budget that is not keeping pace with changing demands and population growth. So our team knows that. We're ready for the challenges ahead. They will be part of our conversation with you in budget time and beyond, but I wanted to acknowledge that and make mention of that to you tonight as well, and respond to any questions if you have any. So that concludes my report, mercifully for you, and merci beaucoup.
Thank you very much, Israel, and thank you for a very comprehensive report. Any questions? Seeing none, can we receive that doctor's report? Received. Thank you. Moving on to item number 3, reducing preventable infectious disease strategic direction. I'd like to welcome Dr. Carolyn Pym to the floor to do a presentation. And then we'll wait for the presentation, and then we'll go back to any questions from board members.
Thank you very much for the opportunity to speak to the report. In its strategic plan, the Board of Health identified enhancing collective capacity to reduce preventable infectious diseases as one of its strategic directions. The report before you describes how Ottawa Public Health approaches the core public health functions related to communicable disease control. It also describes how we're focusing our efforts in response to your direction, and we're seeking your approval of a four-pronged approach that we have developed to advance this critical aspect of public health. As you know, substantial advances were made in the 20th century in the forms of new vaccines, diagnostic tools, and antibiotics. In fact, there have been times over the last 100 years that claims have been made that infectious diseases have been beaten, but every time microorganisms have shown us that actually they're the boss and it's not really a realistic goal. Few in the room will be old enough to remember polio epidemics in the 1950s with people in iron lungs, like you can see in the top left photo here, because thanks to intensive public health efforts, polio has been nearly eradicated in the world. But the World Health Organization warns that failure to eradicate polio from these last remaining strongholds could result in as many as 200,000 new cases every year within 10 years all over the world. And we know that this is just an example of what could happen with other infectious diseases as well. We may not remember the polio era, but the other three photos on this page reflect issues of today, whether it be the Ebola outbreak in West Africa or stubborn old infections like whooping cough or syphilis, which are the pictures on the bottom there, both of which are proving very challenging to control. Next. Control of infectious diseases is core public health work, which is as relevant today as it was hundreds of years ago. The report describes these key strategies for public health infectious disease control, and all of them work in concert. We actively monitor over 70 diseases of public health importance. Some aren't common, but even a single case of some can signal a major threat that requires prompt and effective response. For example, as you may be aware, over the Labor Day weekend and subsequent week, we had dozens of staff working to follow up just a couple of cases of measles and ensure that the community was protected from any further transmission. So we have many effective tools to ensure success, but challenges remain. Despite immunization being one of the most safe and effective ways to prevent serious infectious disease, we are to some extent a victim of our own success in this area. If someone has never seen measles or diphtheria, they may question whether a vaccine is needed. But the reasons for vaccine hesitancy are more complex than just that, and we need to find new ways of ensuring the public's confidence. Another big challenge is the unpredictable pattern of many infectious diseases. Anybody who's worked in public health dreads Friday afternoons because you never know what's going to come down the pike and affect your potentially your plans for the weekend. So we need to make sure that we have surge capacity for short-term responses. We also need new, tailored, and more holistic approaches that acknowledge the social determinants of health, particularly for longer-term infections such as tuberculosis and HIV. The board recognized the importance of infectious disease control and the ongoing challenges in your strategic plan, and the report describes OPH's proposed response to that direction, an approach that aims to move us forward and ultimately improve the health of our population. So the first focus seeks to increase immunization coverage, and as Dr. Levy's already talked about some of the new initiatives related to immunization, and the board's received a number of reports over the last year related to our three-phase immunization strategy. As you know, the first phase focused on assessing school children's immunization records. The effort's been extremely successful, and I'm really pleased, and I know the team is extremely pleased and proud that now our coverage rate for mandatory vaccines in students is over 95%. But some of our residents face challenges in accessing immunization. So we have expanded the hours of operation and the range of vaccines that are offered at our clinic at the Mary Pitt Center. Clinics are now offered 5 days a week. Over the next 2 years, our team will be analyzing available data in more detail and working with partners to identify under-immunized groups and to develop strategies to reduce the barriers. The second of our 4 thrusts is ensuring that OPH staff have the capacity to be nimble and respond to unanticipated infectious disease challenges. We've begun the development of a rapid response team, which is a group of staff from across the organization who can be deployed to assist our communicable disease teams with large or multiple outbreaks. In 2016, we trained nurses and public health inspectors who can then be called upon when additional pressures stretch our communicable disease teams. And we're also proposing to train staff from other disciplines to round out the team. We've also taken advantage of unplanned events and are continuing to adapt our services to new situations, such as the rapid arrival of Syrian refugees in the first few months of 2016. The report describes how we adapted our immunization and infection control approaches to the hotel environment where most of the refugees were staying. Outbreaks continue to have significant impact on the people who live in long-term care facilities and retirement homes and in the community as well. They also have repercussions for other sectors of the health system because transfers to and from hospitals may be limited if a facility has an outbreak. These facilities are really quite varied in their size, the age of the building, the vulnerability of their residents, and in their staff's capacity and skills for infection control. So we've developed a multi-year strategy to support and build capacity in those institutions, focusing on those who previously have shown to have challenges in control of outbreaks. Finally, we've explicitly considered how we can enhance our work with partners, whether that be enhancing the capacity of physicians to diagnose and treat sexually transmitted and bloodborne infections, or working with partners who serve priority populations at particular risk, or embarking on new collaborations such as a feasibility study of a new treatment for TB infection. We wanted to make sure that although working with partners is just the way we do business, we wanted to make sure that this was a special focus, particularly for the infectious disease strategic direction. In summary, then, infectious disease control is something we just can't afford to ignore. Because of changes in the world and in our own society and the unfailing ability of microorganisms to adapt and capitalize on any weakness in our response, we need to be able to adapt while also sticking to our knitting in terms of the basics. We're seeking your approval of our focus areas and actions and look forward to your feedback. Thank you.
Thank you very much, Dr. Pym, for your presentation. Questions from the board? Member Poirier.
Yes, Mr. Chair, thank you. Congratulations, by the way, on the exemplary standing with Accreditation Canada. And we've been having discussions with them as well, and there's an increasing focus on client engagement. And so I just wondered if part of your strategy is going to be to engage clients to get feedback on how to extend the reach and how to target specific groups if that's appropriate.
Absolutely, yes. I think certainly our sexual health strategy and our sexual health team is working very, very hard in terms of client engagement and looking at ways to engage clients. Our strategy for the outbreak strategy is adding dimensions by which we will be asking for feedback from the long-term care institutions. So, for example, we'll be providing them with a summary of each outbreak, and then also seeking their feedback on how things might go better next time. Are there other supports that they need? So we are working on those areas.
Thank you. Anybody else? Member Kakash.
Thank you. In the presentation, you mentioned the refugees, and I want to thank public health staff for the work they did in the initial period in the hotels with the immunization clinics, as well as the dental clinics. I see Nancy Kennedy's here and her team did a lot of work there. I'm just wondering if there's ongoing or follow-ups that are taking place with the refugees, or is our role seen as a one-time, when they're here and some of the issues that were there, or is there any follow-up and ongoing work that's happening with the refugee community?
In terms of, well, certainly there's ongoing work with the dental program, which is beyond the scope of this report, and we're continuing to have clinics with dental clinics, I think at least till the end of the year. Nancy can correct me if I'm wrong. With respect to infectious diseases, it's more on, at this point, it's more on an ad hoc basis in terms of responding to any infectious diseases. But with respect to immunization, as part of the immunization, As part of the immunization strategy, one of the pillars is to be, and in the second phase, is to be looking at under-immunized populations. We certainly found in the clinics that we had in the hotels that there was excellent uptake of the vaccines, but certainly challenges related to literacy and language meant that we would need to continue to work with the refugees for ongoing immunization.
Okay, so you stay in contact with some of the settlement agencies and those groups. If there's issues, they come to you for assistance?
Yes. So the Health Task Force of the Refugee 613 has disbanded, but there is an ongoing organization of immigrant serving agencies which we're remaining in contact with, so that we can ensure that if there are ongoing issues, we can work with our partners. But certainly the experience with the refugees really gave us an excellent opportunity to build our relationship with some of the community health centers and as well as with the immigrant serving sector. So I think those partnerships we'll be working to strengthen as well over the next couple of years.
Okay, thank you, Chair, and I always highlight the work that OPH staff did do with the refugees when I'm asked to speak at various events, whether it's to the NATO Parliamentary Group recently or to the UNESCO One Young World Summit that we had a couple of weeks ago. A lot of people are seeing the work that Ottawa's done, both as a municipality and Canada, obviously, as well, the leadership, the political leadership at the federal level, as well as us as a municipality, and that includes the OPH staff and the work that they did in that initial period when the influx of Syrian refugees came to Ottawa. So I just want to highlight that and thank them as well.
Thank you very much, Councillor. And based on that same comment frame, I want to thank you for all your work on behalf of the City Council in terms of the refugees scenario with us. Okay, so thank you.
Yes, thank you. Thank you for the presentation. I just have two questions. One is specific to the bracket that you call, I think it was the third pillar, the negative impacts on outbreaks, and it was more specific to long-term care. And I've certainly noticed the past few years how every winter, you know, I have a few, I have Gary J. Armstrong, the Champlain, and there's always those issues. What is the primary source of the outbreaks in those locations? Is it because of low immunity from the senior community? Is it because of cleanliness in the operation? I certainly have gone many times and I feel it's always very hot in those premise, and I wonder if the temperature that we keep in those buildings actually has an influence on the spread of the outbreak.
Well, certainly temperature can be a factor in the growth of microorganisms, for sure. They definitely like warm and moist environments. But there certainly are a number of factors. You have a vulnerable population in terms of not only their physical capacity, but sometimes if you've got people with dementia, their personal hygiene can be a factor as well. I think what we find is that in the facilities, they're stretched. They're stretched as far to try and do all the things that they need to do to care for their residents. And they do have variable capacity in terms of staffing. I mentioned the age of facilities. Some of the facilities are quite old and not necessarily originally set up to according to modern infection control standards. So they're working within an environment that may be difficult to implement some of infection control measures. So that's why, I mean, in not this year, but in recent years, we've developed facility profiles which help us really understand what the capacity in the facility is in an outbreak, and then that combined with our experience during outbreaks and how they can manage them helps us to try and tailor our responses and our support. So one of the examples that we're doing in this strategy is to develop sample policies and procedures, because amongst all the other things that the facilities need to do, infection prevention control, while extremely important, is, they don't necessarily have the time to develop their own policies and procedures. So if we can provide them with the template that they can just customize, it serves not only as to help them with their work, but also as an educational tool. So there's environmental factors, there's skill and capacity factors, there's factors related to the population, as well as what's circulating. So we know that last year was a pretty light year for flu for elderly people because it was an H1N1 year. If we have an H3N2, which is a different strain of the virus this year, that disproportionately tends to affect older people, like we had a couple of years ago when we had over 100 flu outbreaks in long-term care.
Yeah, I'm happy to hear we're helping our partners with protocol, but I certainly would go above and beyond that and, provide, I remember my grandparents and my mom talking about when the sisters ran some of those schools and some of those health centers, it smelled like chlorine and it was, shiny floors and so on. Times have changed, products have changed and so on, but certainly I believe that, there's a few elements that tie into all of this that could actually get to the bottom of it. I think maybe we can't do it everywhere, but we certainly should pilot different approaches and see which one actually gets us. But maybe the protocol is one of them, but we should look at other incentives as well to recognize and to support the various partners. I'm not looking for an answer. It's just
No, that's a very good idea, though. I think we can certainly take that away and look more at that.
And then my second one was more of another comment. In the category partnership, I think that we do a really good job of partnering. I see public health posters, and when I speak to different administrators in the health field and long-term care and even in physician's office, they certainly have good contacts with public health. So new partnerships, I don't know until when we can continue to expand the partnership. I think we have to be honest with that. It doesn't mean that we shouldn't be ears open for new partners, but I think we're really well connected, and I think we've done a good job of that. So certainly, if there are opportunities, great, go for it. But I think all the low-hanging fruits and a lot of the core partnerships are pretty well established now.
Yes, that's true, and I think we do have a number. I think that we can always enhance that. Even just as Councillor Kakish mentioned, we, in terms of with the Syrian refugees, we realized that there, we had more opportunity to work with the immigrant serving sector, and now we've established some additional partnerships that we can work on. For example, tuberculosis. I mean, most of our tuberculosis is in individuals who were born in other countries. Although the federal government has a program for identifying active cases of tuberculosis, there's a large pool of people who have latent or sleeping tuberculosis, and we need to be working more with different communities to try and prevent that latent TB from becoming active. So there's that case, and then there's other partnerships. Again, with TB, we work very closely with our clinician partners at the Ottawa Hospital, but we're now embarking within the next couple of weeks on an exciting new study of actually a new treatment that may affect, may have national implications in terms of preventing TB. So I think it's looking at are there partners that we're missing, but also enhancing our relationships with existing partners.
Thank you, Councillor. Anybody else? Seeing none, can we receive this report with the 4 recommendations? Carried? Thank you. Moving on to item number 4, Ottawa Public Health submission to the Federal Task Force on legalizing marijuana. I'd like to welcome Gillian McDonald to come and do a presentation for us. See, Gillian, this is how long you've been away from us. Even forgot your last name. Call McDonald instead of calling. Welcome.
Thank you. You're going to start? So good evening, just while they're setting up. As the chair mentioned, I'm here before you this evening to present the recommendations that Ottawa Public Health staff, professional staff, put forth to the federal government's task force on marijuana legalizing regulation. OPH staff submitted its public health advice to the task force at the end of this summer. The recommendations put forth by public health staff were based on public health advice, scientific evidence, and lessons learned from tobacco and alcohol. Our main focus was to reduce harms to all Canadians, especially youth. I just want to take a moment here to actually thank the team. Jacqueline Roy, who's sitting here beside me, she's the program manager for our substance misuse and injury prevention team. Her team led the work on the submission, and it was a high order to be done, so very much appreciate your team's work. I'm here before you because our team responded to the discussion paper that I mentioned, and our team responded to the discussion paper for a few reasons. Our team's continually concerned with the health effects that Ottawa residents experience when they consume psychoactive drugs, especially youth. We're also concerned with the prevalence of youth who use cannabis, and based on these two factors, we embrace the opportunity that the federal government put before us to inform the legislation pertaining to the legalizing of cannabis, with an aim to reduce the harms to the population as a whole. As mentioned, there are harmful effects associated with the use of cannabis, especially for youth who use it frequently and or begin to use it at an early age. Cannabis use during adolescence and young adulthood has been linked to negative effects on brain development. This includes cognitive impairment, which can affect memory, perception, attention span, and psychomotor performance. Heavy cannabis use during adolescence has been linked to more serious and longer-lasting outcomes than during adulthood. Studies have also linked frequent cannabis use to mental health issues. This is particularly in people who have pre-existing genetic vulnerability to mental illness. Several studies have found a relationship between regular cannabis use and psychotic disorders, particularly in individuals who begin to use cannabis in adolescence. And finally, cannabis can be addictive. There are a number of factors for cannabis dependence, which include early onset of use, frequency of use, previous drug use, and the presence of other mental health disorders. As you can see, this is quite a complex web, and there's many areas that there's still a great deal of research that's needed. But what we do have a clear understanding is that there is health effects for youth, especially those who start young and use frequently. We're also concerned with the prevalence of youth who use cannabis. In Ottawa, in the past year, almost 40% of young adults aged 18 to 24 years old have used cannabis in the past month. For 15 to 17-year-olds, 18% have used cannabis, and 14% of those aged 19 or older have used cannabis in the past month. Based on these two factors, it's evident that youth have access to cannabis despite the system that we currently have, and there's a need to reduce their access. So in response, in 2015, the federal government committed to legalizing, regulating, and restricting access to cannabis. Towards this goal, earlier this summer, the Minister of Justice and the Attorney General of Canada, the Minister of Public Safety and Emergency Preparedness, the Minister of Health created a task force on marijuana legalizing and regulation. In June 2016, this task force invited Canadians and experts to provide comments on a discussion paper which outlined considerations and posed specific questions about legalizing and regulating marijuana. This past August, Public Health put forth our recommendations based on best practice and scientific evidence. In general, the task force discussion paper outlined 5 key themes for the public and stakeholders to comment on. These key themes were minimizing harms of use, establishing a safe and responsible production system, designing an appropriate distribution system, enforcing public safety in production, and accessing marijuana for medical purposes. The process that OPH used to submit our comments to the discussion paper was quite a fulsome approach. What we did was the staff collaborated with the Provincial Marijuana Collaborative. This is a group of about 28 health units who've joined together to promote a comprehensive public health approach to legalizing marijuana. As well, staff examined emerging health evidence and took into consideration the positions taken by other health units. In addition, as I previously noted, that we have some limited research in the area of cannabis control, the team took from lessons learned from tobacco and alcohol and looked at other lessons from other jurisdictions. Staff culminated all this data together and put forth and recommended a public health approach, a guide to legalizing cannabis. As a result, many of the recommendations were based on the alcohol and tobacco control measures. As well, staff recommended that ongoing research specific to cannabis be conducted. More specifically, OPH recommended that a public health approach would include the following 4 guiding principles: that the federal government invest in health assessment, surveillance, and research. There's investments in health promotion and prevention activities. There's implementation of health protection measures. And most importantly, there's sufficient supports for evidence-informed early identification and treatment for individuals who have problematic use. As mentioned, public health staff have already submitted our comments to the discussion paper, and since that time, public health staff have been monitoring developments with respect to the federal government legislation and related provincial initiatives. We are acutely aware that the regulations and control of cannabis will involve all 3 levels of government, that the federal government will lay out the basic framework and regulations, and that the other levels of government will then be able to assess the need for additional regulations and bylaw should there be any outstanding concerns. Next steps for the federal government will involve the task force presenting a final report in November 2016, which will provide evidence to the ministers on the design of a new legislative and regulatory framework. This final report will be made public by the ministers at a time to be determined by them, and we're expecting that to be in the spring, this coming spring. And in preparation of the federal government's announcement, OPH was continuing to participate in the Health Units Collaborative and will update the Board of Health as appropriate. Thank you. Are there any questions?
Thank you very much, Gillian. And Doctor, you want to comment?
Thank you, Chair. If I can just inject a few perspectives before questions, I'd appreciate that. Thank you very much, and thanks to Gillian, and congratulations to the team for what you see before you as a manifestation of real nimbleness. I think we've been grappling with marijuana as one of the psychoactive agents that's used in the community that has health implications, that is used historically in the context of a judicial framework and a legal regulatory framework that renders it illegal, also has implications for health. So this has been a core part of our ongoing work, and the team of one, pretty much, Jacqueline and Gillian have a very small group that look at addiction issues, how to prevent addiction issues, has historically worked with the Canadian Centre for Substance Abuse. We put out, where we can, messaging. We do joint workshops to try and ensure that people are aware of risks. What really came to the fore with the evolution of this particular file was that on June, Gillian says June, it was June the 30th that the federal government announced the task force, and the task force immediately put out a consultation paper with a timeline of August the 29th. And so the decision that we made at the management table was we cannot let this opportunity go by. We need to embrace this opportunity. The implications of where this file is moving are profound from have potential profound effects from a public health perspective, and also from an operational perspective in terms of what any local health unit might need to be doing depending on how the file unfolds. So there's a lot of uncertainty but we have an opinion. There's a limited scientific and clinical base to build that opinion on, but let's be nimble, let's embrace the opportunity, and let's start developing our own expertise, but also let's register our stake in the ground in terms of the other levels of government work on this. That same approach was pretty much taken by the collaborative of 28 other public health units in Ontario, so we did pretty quickly galvanize as a public health professional community in Ontario over the summer period, and that's just some contextual space to feed to you as you consider where we are and how we're evolving and where we're going. I've been on the record welcoming the change in the legislative framework that is being brought to bear on this, because there are definitely health implications, negative health implications that flow from the criminalization of marijuana and indeed all illicit drugs. But clearly from a harm reduction point of view, it's important, very important, and it's come up around this table before, that isn't interpreted to mean that what we're talking about here is candy. Candy, of course, isn't safe from a health perspective, but psychoactive substances aren't in a different way. And so we need to put our positions forward strongly so that they're heard, and that we can be part of the public policy discussion as it unfolds. So that's why we wanted to bring this to you tonight for information as well. And thanks very much to Gillian and Jacqueline and the team for enabling us to do that, because it did mean really some juggling during the summer in terms of the group being able to get this far. Thank you, Chair.
Thank you very much, Doctor. And just before we go to questions on this report, Member Lakin has got a motion regarding this item. So, Member Lakin, if you want to move that, please.
Sure. Thank you, Mr. Chair. Yes, let me read the motion, please. Whereas the federal government is expected to introduce legislation in spring 2017, further to the current work of the task force on marijuana legislation and regulation, and whereas the legislation that the federal government is expected to table in 2017 may not fully address all the public health concerns identified by OPH and or other public health agencies through the summer 2016 public consultation process, therefore, be it resolved that staff report back to the board with an analysis of the legislation at an appropriate time in 2017, with the objective of a potential further submission from the Board of Health to the federal government as part of the legislative process, and be it further resolved that staff monitor any provincial developments on this issue and the implications for OPH policy and practice, and report to the board as appropriate.
Thank you very much, Member Lakin. So just for everybody on the board, that motion is on the floor. And my first question here is Councillor Fleury.
Thank you, Mr. Chair. I will not be speaking to the motion, although I am very comfortable with what is being proposed. My question relates to a couple of the elements of the report. I certainly applaud the work. I applaud the seriousness of the proposal. I'll preface my question by saying that many of our colleagues at Council have been very confused and certainly very frustrated with the approach from Ottawa Police Services relating to the dispensaries that we've seen pop up left and right, including most recently in the area of where our chair in Stittsville, and certainly I think it highlights some of those issues. I want to go into some of the elements that we brought forward as part of the ideas, and I want to start with the proposal of the age that was brought forward. So, as we know, if you want to purchase alcohol in Ontario, I think the age is 19, correct me if I'm wrong, and I think the same is in place for cigarettes. So although I recognize that the brain, I understand why we're coming from in terms of the age 25, which is the maturity of the brain and some of the impacts on that. I think we should be careful of continuing to push the market underground by providing that age group. The report and the data speaks that the majority of high school students, age 16 to 20, because we could expand that to colleges, do consume and do touch the substance. So if we recognize that that group is going to try it, attempt it, I would much rather be it in the context of a standardized product. And that to me is where THC levels, the access to that product might be rethought. So for me, the age of 25, I think is a misguidance, and it would continue to put our youth more at risk, and also our youth more integrated in the criminal gangs and dealers, which is what we're trying to get away from. So I would caution us on continuing to hold that stand, although I understand from a public health standpoint the brain maturity and the brain impacts. I think that our most gain would be on the standardized products related to the THC levels, which could alleviate some of those challenges relating to schizophrenia and other elements. So I don't know if you could speak to that, and you know, I don't know if I really clearly articulated what the approach was related to the age 25.
Yeah, so I appreciate, what I'm hearing from you is that you're saying that you recognize where we came from and the scientific basis that we put forth for the 25, but then as a result of that, you're speculating that we might be continuing to have a black market in essence. And I think one of the things that we looked at is that when you're looking at the alcohol and tobacco, these are two systems that are currently in place, and so you have a clear understanding of all the pieces of the puzzle. But with the cannabis piece is that starting at, and this is how we visioned it, was that we're starting with a clean slate. And there's going to be a lot of factors that will be put into play and determine youth access, black market, and whatnot. And so not having a clear understanding of which recommendations the federal government will be taking and which ones will be contributing to that, we wanted to put forth consistent public health messaging, recognizing that a lot of factors will be taken into consideration. So we're providing input into this point of the consultation, recognizing that other sectors will also be putting their pieces in. And so some people might be coming up and say it's 15 or this or that. We really wanted to present the evidence that anyone under 25, there's risks. And that we're looking for them to be based on scientific evidence from our perspective. That doesn't take away from all the other sectors and all the other pieces of the puzzle that the federal government will be looking at. So we will be, and we very also recognize that this is the beginning point of the consultation piece, and what we're expecting is that, and the federal government has signaled, is that in the spring they'll come forward with additional legislation, and we'll be able to comment on that. And at that time, we'll have a greater understanding of all the other pieces of the puzzle that they're putting forward. So we'll have a better understanding of the whole distribution, production system as a whole, and the pieces that they're putting in. And at that time, we'll be looking at it again with fresh eyes. So I appreciate what you're saying, and I think that that's something that we're quite cognizant of, ensuring that youth access gets diminished, not only through the regulation system, but also through the black market.
Okay. A couple more pieces. So there's two streams. There'll be a recreational stream. There'll be, I guess I'll define as a medical stream. How does that play with our responsibility in terms of workplaces? I'm not saying that marijuana is like an asthma pump. I'm not trying to say that, but I'm giving the example of if I have an asthma attack, I'll be able to use it in my work of place because I'm not impacting the people around me. What will be, or what is our intent, and maybe that's more directed to Dr. Levy, around the use of a prescribed prescription for marijuana? On the medical front, I think on the recreational front, it's less of a case, but if someone as an employer, private or public, comes and says, hey, I'm allowed, I have to use this medication for anxiety, whatever it might be, you're the doctor. How do we legislate that to not have impacts as we might have had on secondhand smoking?
Chair, unfortunately, I don't have the wisdom of Solomon on this one. I can tell you my position. I don't know where it's going to end, and I'm not sure if the debate is going to end up shifting my position as this question gets grappled with. The challenge we have is that and I'm not a lawyer either, but my understanding is that from a human rights perspective, there is a case to be made that the individual would be entitled to use his or her medication at the time and in the place that he or she needed it. From a public health physician's perspective, the concern with that would be what is the unintended consequence to others by that individual having that liberty. And the two predominant concerns would be if the substance is smoked, there is obviously secondhand smoke, and one has all the concerns about the exposure to secondhand smoke that we're very familiar with and that we've taken I think, a highly protective approach to for the non-smoking individuals. If the product is not smoked, but for example vaped, or some of those issues arguably would fall away. We might be less concerned that others around the individual would be exposed to toxic substances, maybe. But we still have other very significant concerns from the point of view of what we generally refer to as normalizing of the behavior of smoking. So the really short version of it is that I cannot see a world in which I would be wanting to condone the smoking of marijuana for medical purposes in public places. I think I would be my position today would be that I would do whatever I could to create environments in which individuals who had prescribed marijuana for their own specific ailments were able to use that medication in their situation, but not at the expense of exposing others around them to toxic agents, and not at the expense of undermining public policy objectives where we've made progress. How that would play out in the minds of public policy officials, in the minds of health and safety folk, in the minds of arbitrators and judges, I can't say, but I know that would be what I would be recommending. And so then that takes one down other paths. That takes one down the paths of alternate delivery systems. Metered dose inhalers, pharmaceutical products where individuals can get the dose of cannabis for themselves, but not necessarily put people at risk. And obviously, there's a lot of research and effort going into that. So I'd look to that for providing greater solutions than we have at the moment. And it also takes us into the realm of what we call the edibles. And that's a whole different series of concerns which we're already grappling with, because from a public health point of view, we of course have concerns that foods are prepared with good microbiological and other standards, and we don't really know what's going on with these edibles even now. There isn't a strong research base to suggest that people are at risk from microbiological, essentially food poisoning, but theoretically that possibility exists even today. So we'll be into a whole different realm in terms of the food safety issues if the solution to that problem turns out to be edible. So I guess the short answer to that question, Chair, would have been I really don't know. But the essence of the longer answer is while respecting the individual needs of individuals who have agreed with their physicians that their ailments would be well served by using marijuana. I would put the interests of the public first and argue that those individuals would need to be consuming their marijuana at home.
Okay, that's a very complicated, response in the sense what you're saying is here are certain areas of possibilities, but it's probably too soon, and that reflects kind of the consultation process. But I think it's important for us as a Board of Health to see how wide-ranging this is. And, I'd highlight the issue, for example, of, as a physician today, under which circumstances would you provide a comfort to prescribe marijuana? I'm not looking for an answer, but I'm not sure that even the health field has contemplated the wide ranges of what that meant, and I think different physicians have different comforts in that. So, there's certainly a wide range, but for us, beyond that, as a public health board, I think our concern is around the recreational use. And the access to some of those, we talked about sugar drinks in the past, Monsters, Red Bulls of this world, and how that's, that appears to have gone unlegislated for so many years. I think there's certainly key concerns that on the recreational front, that we might not have the desired daily use or whatever that chart that we're all familiar with in terms of Health Canada and the Canadian Food Guide, no matter what you think of it in terms of that. So I'll leave it at that. I think you provided sufficient, pretty broad response in terms of that, but we'll need to perhaps have a little working group here at Public Health to continue the discussion, to not miss the future windows, as recently highlighted by our Attorney General, who was looking to provide the Ontario response to the federal review. Thank you, Mr. Chair.
Thank you very much, Councillor Fleury. Member Tilley.
It's great to see this recognition of some of the cognitive problems by the addiction in youth. I know from speaking with a recent doctor about the tobacco addiction through the cognitive development stages, that it can be much more severe, and I think that's what you're saying is also your study of marijuana. It's great to see that. Also the acknowledgement of the mental health effects such as schizophrenia, later diseases. My wonder is, as I'm looking at, may not fully address all the public health concerns that's in the motion, is any consideration being given to, we often hear that term, gateway drug. So there's that consideration of marijuana and whether it's the addictive piece of the gateway drug leading to other drugs, but certainly in my sector, I work in a lot with the homeless population and those who are vulnerable. The gateway is sometimes by association of the company that you keep, especially for youth under 25, where now they're being brought into association with people through maybe purchase of marijuana, leading to much more severe drugs, such as we're seeing coming on the horizon here. That could be many other choices. So is there any consideration going to be given to study of gateway, whether addictive or gateway by association, if we're really looking at dangers and some of the health concerns? It could be that. Do you think that may be included?
I appreciate that, and I think that's one of the pieces that we'll be looking for. So I think back to Councillor Fleury's comment about having a working group, we've started that, and I think we've identified a number of areas that we really need to be making sure. And one of the pieces that you hit on is one of the motivations that encourage or contribute to youth using cannabis, and so the social context is one of them. How it's seen is one of them. It's sociable, social norms about its harms. It's enhancing the psychotropic components of it. So one of the pieces is looking at the multiple factors of this. So what you have in front of you is our recommendations for the federal policy component of it, and one of the pieces that we'll be taking back and looking at is that health promotion component of it. And so what education and information does our public, does Ottawa residents need in terms of this? And so what you're talking about is that gateway component of it, and does that contribute to it? It is something that we will look at, as well as the social aspects of cannabis use and drug use as a whole.
So you're saying it could be coming forward then in recommendations or partly from Ottawa Public Health to the federal level?
We could be bringing that forward. I think one of the things is we're not sure what the federal government will be bringing forward. So what we're doing is we recognize that the federal government is going to come out with this legislation, and it's coming. We don't know what it looks like, but we know that we need to be looking at it at a local level of what messages need to get out. And so what you're hitting at is the youth piece. So regardless of whether the feds are going forward with this or not, we know that the youth component and the health effects of youth is an issue. And so looking to see what we need to be doing at a local level to be getting that information out about the health risks about that.
So let me just clarify, the federal government legislation will come up first, and then our recommendation would come forward, and then we would move forward with an education piece aimed at some different sectors such as youth. Is that what you're saying?
You're asking us about the process and the phases of it. I think they're going to coincide. They're not going to be one and then the other. We have been doing some pieces with the youth. So the Canadian Centre for Substance Misuse came out with a report outlining the health effects of youth. And last February, we did a town hall with them and started to share that information. I believe Councillor Shanashenko attended that, or you got some information as a result of it. So we're continuing that process with the youth. So we're not waiting for the federal government's component of that to come out before we do our education.
Okay, thank you.
Thank you very much, Member Lakin.
It's okay, actually, thank you, Mr. Chair. My questions have been answered.
Thank you, Member Poirier. Member Lakin.
Thank you, Mr. Chair. Thank you to staff for preparing the brief and introducing for the first time publicly the conversation that will need to occur as recreational marijuana use becomes legalized federally, and beginning the conversation on the development of policies and practices for us locally with public health implications. Knowing that the federal government will receive your brief and deliberate, but that our public health response will in many ways be informed by provincial legislation. Is there any information at this time that can be provided about what's going on at a provincial level that may inform the development of our policies and practices with respect to this issue?
I don't have any information at this time. I don't know if ISRA does, but I think there's a little bit of a wait and see. So kind of going on with what Member Tilley was saying, I think that the provincial level there is a waiting to see what the federal government comes out with. The provincial level will come out with theirs, and then we'll be developing ours, and that's in a policy. That's from a policy stream.
Thank you. One of the recommendations I appreciated seeing in the brief was to learn lessons from Colorado, which I presume for us might include ensuring that the Ottawa Board of Health doesn't become its own reality TV show. Can we expect down the road, and I requested in my motion to have a follow-up, can we expect down the road to see a more formalized process once we have more data and legislative clarity, a more formalized process to develop local policies and practices with respect to public health issues regarding recreational marijuana?
I think that, so what you're saying is you're asking if once the federal government comes out, would we have a more formal process about developing the policies at a local level that might have impacts?
Yeah, I realized this brief is in response to the task force, but down the road, what can we expect locally to occur?
So in preparation for this report, and as we continue to go through and on what Councillor Fleury was saying about the dispensary, we've had some discussions with the internal staff about what would the policies look like and how would that have implications for other departments. And so it's definitely something that's been on our radar. And so there are pieces of the puzzle that we would be doing some potentially proactively, or even just proactive thought process in terms of what would happen with these pieces, or what would we be looking for. But we will be looking to, if there are gaps, to seek to, from a public health perspective, to have some discussions internally at their city departments about that.
Thank you. I'm sure I'll have more to ask down the road at your next briefing. Thank you very much.
Thank you very much, Member Lakin. And Member Chernyshenko.
Thank you. Just a brief comment. I'm certainly very interested in the age limit choice and your explanation that you chose at this point to really prioritize the risk to brain development over and above issues like black market or criminal element and a number of the other factors which I think Councillor Fleury elaborated on quite well. I'd actually like to commend you for doing that, because I think if not at this point, when would we as a Board of Health and as Ottawa Public Health have done that? The little bit that I know, and perhaps I know only slightly more than the average person, having taken an interest in this for a while, I don't know if this makes me any different than most citizens, but more than I can count on one hand, I know of childhood friends, children of family members, and others who, whether it's schizophrenia or other health problems that seem to be related to or exacerbated to their marijuana use at that sort of 16 to 20 year age. I've seen it myself, and that, as well as seeing the nature of things and all those other documentaries that you can watch on it, enough to cause me considerable concern, and to be grateful that we're saying, hang on a sec, let's understand the science on human brain development and make that a high priority at this early stage. Then we'll deal with, is it practical, and other trade-offs around trying to set an age limit that might just be so out of whack with what can be enforced. But I do thank you for bringing that forward at this time.
Thank you very much for your comments. I appreciate that.
Thank you, Councillor. Anybody else? Just a question from my perspective, Ms. Connolly. In terms of the public input into this process, at what point does that take shape into this process? Do you know, or are you aware when the federal government is going to be discussing this with the public?
The public did have an opportunity to also provide comments into this this discussion paper, and I believe, should they be following a regular process, that once the legislation comes out again, that the public could provide comments at that point. I don't have any definitive information on that, but the public did have opportunity to provide comments onto this consultation paper.
Thank you for that. Now, just coming back to that further question on that, if and when that public comment period is initiated and fulfilled, and it changes something through the debate or through the discussion with the public in terms of policy, would we as a board be going back and reviewing our recommendations also at that point if it needs changes?
In reading a lot of the documents, to be frank, that we put when we were looking at other health units and other agencies that put forward their recommendations, one of my favorite ones that I wish that we'd put on ours was a big asterisk, was we reserve the right to change our minds should other factors be taken into play. And I think one of the things is that this is such an emerging health issue, and a lot of, as I was saying, that the legislation is going to be quite a puzzle to be putting together. And I think once the federal government comes back out their legislation, we'll definitely be looking at it again with the health evidence again and based on what they're looking at. I don't want to be saying that we're changing our recommendations, but we're very open to ensuring that our recommendations are health evidenced based on best practices, but also we will be considering other factors as we continue to move forward on this quite complex issue.
Thank you for that. Anybody else? Any other questions? If not, can we receive the report and approve the recommendations of the report? Oh, sorry. The motion from Member Lakin. Can we receive or can we accept that motion? Carried? Thank you. Now, can we approve the report as recommended, as amended with the motion? Carried? Thank you. Now I'm going to hand the floor back to Member Tilley to do the motion to adopt reports.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, Reducing Preventable Infectious Diseases Strategic Direction Report, Ottawa Public Health Submission to Federal Task Force toward the legislation, regulation and restriction of access to marijuana, 2016 Operating Budget Q2, Board of Health for the City of Ottawa Health Unit Status Report, Delegation of Authority, Contracts Awarded for the period of January 1st to June 30th, 2016 report, and Ottawa Board of Health Public Health Funding and Accountability Agreement 2016 Mid-Year Update be received and adopted. As amended.
Thank you, Member Tilley. So is that carried? Thank you. Motions of which notice has been given previously, we have none. Motions requiring suspension of rules of procedure, unless somebody has one, we're okay to carry that. Notices of motion for consideration subsequent meeting. Anybody have any? No? Thank you. Information previously distributed. Confirmation bylaw, Member Tilley, please.
Be it resolved that confirmation bylaw number 2016-4, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of October 17, 2016, be read and passed.
Carried. Thank you. And any inquiries, members? No? Thank you. Could we get a motion to adjourn, Member Tilley?
A motion to adjourn.
Carried. Thank you, everybody, and thank you very much for this evening's participation.
Thank you.
Take care.